I feel called to talk a little bit about fertility. I've had a lot of fertility cases since 2020. I don't know, I guess since the lockdown, there's been a lot of women desiring to have children. And so I had to really brush up on fertility come 2020. And so one of my favorite things to utilize for fertility is the Dutch hormone test. It's a urinary hormone test, and it kind of evaluates all of the different hormones that women and even men have at a very subtle level. So it helps us perceive differences in estrogen, testosterone, progesterone, cortisol, and just different vitamin deficiencies and gut health. So I love to use that for women seeking fertility support, and I'm not even joking, 25 to 40% of the time when I have a fertility case and I give the female patient the Dutch hormone test, they come back pregnant at the follow-up. I think there's something special to having a woman tune into her cycle and being aware of what day she's on for a month, because the Dutch test is, if you do have a menstrual cycle, it is completed at the later aspect of your cycle, so it adds extra awareness to where you are. Secondly, in terms of preconception care, I always think it's wise for women to think about preconception in about 3 to 4 months time, because the supplements and lifestyle habits that you're doing today have about a 3-month cumulative benefit. And so if you're truly wanting to have the best potential egg, or for the men, sperm quality, the interventions you want to think about for 3 to 4 months ideally to optimize that sperm and egg quality to get your healthiest happy baby. Secondly, in terms of fertility, of course, acupuncture and Chinese herbs has been a great aspect or tool that I have in my practice that I utilize. Once conception happens, or the baby, or the positive pregnancy, I always have a serious discussion with my patients. When we do get that information, I tell them, please email me right away when we get this information, which is great. I love to be one of the first people to know, but the urgency in real time of me knowing this is I often will, order the blood test, pregnancy test to double confirm, and then additionally there's 2 blood markers that I really want to check, which is your thyroid health and your progesterone levels, because over time, over the last 6 years, I have seen issues with progesterone not increasing as it should, and then additionally I've seen women with normal thyroid function, the moment that they do get pregnant, it is an extra tax on the body. It's